Are you ready for some research behind nutrition? Stay tuned for this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. If you're watching this on YouTube, welcome to our regular listeners and to new visitors, new listeners. We welcome everyone. We're so excited and happy that you are taking some time to hang out with us this week. That means a lot to us. We know everybody has busy schedules, so thank you very much from the bottom of our hearts. So today we have a guest speaker who actually, this is his second time with us. We did another podcast with him recently. And his specialty is in fasting and nutrition, Dr. Chris Rhodes. And you can go back, I think it was probably about a month ago that we did a podcast with him. And so he's back again. And so we're really excited. And I'm going to go ahead and bring him on, okay? Hello, Dr. Rhodes.
Hi, thanks for having me back.
Hey, welcome back. We're so excited. And we were just telling our listeners, has it been about a month since we did our last episode with you?
Yeah, maybe a month or two even.
Yeah, a month or two. The time goes by so fast.
It really does. Oh, especially this year.
Oh, yes, absolutely. Yeah, well, we're really happy and excited to have you back. And, for those of you that did not listen to that episode again, please go back and find that episode. It's a great episode we did. Dr. Rhodes taught us a lot about fasting. And he also has his own product or products, and so he spoke about that. And so today we're going to focus a little bit more on research, on nutrition and research behind some nutrition. So Dr. Rhodes, please enlighten us.
Yeah, absolutely. So. I'm happy to talk to you guys about all things nutrition. I got my PhD from UC Davis in nutritional biochemistry. It's also one of the things that I talk about on my TikTok channel all the time, kind of the myths that are out there in the nutrition world, debunking kind of the trends that come up within the space and helping people to better understand how to think critically about the information that they hear around nutrition, check their sources, and find out more of the research.
Mm-hmm. That's awesome. Yeah, we do a series called Wake Up America that does this very similar thing, so that's awesome.
Yeah, absolutely. So, I mean, what have you guys seen out there as kind of some of the most prevalent nutrition myths?
Oh my goodness, where should we start?
I wouldn't even know where to begin. Yeah. I mean, we get a lot of patients who are doing the fad diets, right?
Sure, yeah.
So that's one big one. I don't know. There's just so much. Don't eat fats. Don't eat any fats is another one. That patients talk to me about. Even Jenny Craig. The counting of calories, right? Things like that with nutrition.
Yeah, I mean a big one that we're seeing now, and I mean a lot of the people that I work with, the staff, the nurses, the technicians are really big into Ozempic and losing weight, and it really is shocking to me the number of people that are on this for weight loss. Even people that I'm just like, you're perfect. You're not even overweight, and I don't know, I don't really get a chance to really delve into their diet or anything like that. But I don't know, are you modifying your diet? Because when I was in training for gastroenterology, the bariatric program, one of my mentors was one of the head of the bariatric program. And he's a gastroenterologist, but he had to interview anyone who was coming in who was interested in having gastric bypass. And there were several criteria that they had to fulfill. Number one, they had to lose a certain amount of weight. I remember the conversations he would have with them, like, your lifestyle has to change. It's not like you're going to have this bypass. If you have this bypass and you go back to eating the same way, you're going to you will lose weight, but you will regain it back. And you have to change your way of eating. He'd tell them, if you're going to have a salad, split a salad with a friend. Are you going to, it was, because if you don't change your way of eating, your lifestyle, if you're not exercising and you're just getting on these, for example, Ozempic and losing weight, but you're not changing your lifestyle, it's going to be hard to keep that off unless you continue on Ozempic forever. But I don't think that that's the plan for people to stay on that forever. So anyways, a lot of different stuff out there as far as, the fads with losing weight.
Yeah, I think Ozempic is a really interesting topic. Obviously it's become a blockbuster drug and pharmaceutical intervention for people. And as you say, it's definitely being prescribed off-label for, not for the diabetics anymore. It's for everybody to lose weight with. Mm-hmm. And I think it's a very interesting parallel that you bring up between Ozempic and gastric bypass, right? Because it all does kind of come back to, if you can't install that lifestyle change of I need to understand nutrition, I need to actually change up my diet, it's not gonna end up working in the long term. And you see this with Ozempic all the time. We know more of the long-term results of Ozempic now, and the latest studies have basically shown that 70% of the people who come off Ozempic end up regaining around 2/3 of the weight that they lost, because when you come off Ozempic, there's a lot of hunger withdrawals that happen, essentially, or at least that's what I call them. Mm-hmm. So, how Ozempic works is that it's mimicking GLP-1 in your body, which is a big satiety factor. So it's essentially helping your body to turn off that food noise, those hunger cravings, and even now we're learning help with just cravings in general. So it's also been very helpful for people with alcohol use disorder or addictions and things like that, to kind of help just turn that noise off and kind of quiet down the reward system in the brain so that it's not overly active. Mm-hmm. But people get adapted to that, right? And then, they start living their lives without those natural cravings that they would otherwise have. And then coming off of it, all of those cravings just kind of come flooding back. And the people who have been on Ozempic, who have had it, pharmaceutically quieted and never learned how to quiet it themselves, then all of a sudden, they're left with all these hunger cravings that they had before, but with no tools or skill sets to be able to properly adapt to them again. So people get into these hunger withdrawals. They haven't changed their lifestyle, outside of just taking Ozempic. So they kind of come back and fall into the same patterns again and regain that weight.
Yeah, that's what, and because most people are not staying on it super long term from what I've found.
Right, yeah. People are very afraid to. And, that's a very valid concern, because we still don't really know the long-term implications of being on a GLP-1, agonist for years and years and years.
Right. Yeah, it's pretty scary. Like you said, how fast this thing is taken off and how everybody wants the pill.
Right.
Yeah, absolutely. And it's funny, too, because talking about calories in and calories out before, Ozempic is contributing to that equation, right? Mm-hmm. One of the reasons why the GLP-1's agonists work so well is because not only do they reduce the cravings for food and kind of suppress appetite, but they also help to keep metabolism high. Mm. And so that's kind of, the GLP-1s would ordinarily in your body be produced in response to food. Which, sends a holistic signal to your body that all right, cool, energy is coming in, so we don't have to turn on our metabolic efficiency programs or, reduce metabolism in order to stabilize energy demands. It's just kind of all right, fine, we're going to keep constantly revving at the same level with the same functionality and not adapt to the lower amounts of calories that we're taking in. So you get that, sustained metabolic rate without not actually having to adapt to the calories. And so then, when people, again, like come off of it, then all of a sudden it's like, oh, okay, now I have a lowered metabolic rate and all my cravings come back. So it's just kind of a recipe.
That's a huge recipe for disaster, for sure. Yeah.
Well, as far as like nutrition, I mean, look, we see the full spectrum of, people that that don't understand nutrition. I mean, for example, I had someone ask me recently when I told them, look, I want you to make sure you're getting enough fiber in your diet, and and their question to me, and it was very serious. They're like, okay, well, is peanut butter Captain Crunch okay? So, so that's just to give you an idea of where and then we have those that come in that their life has been pretty much like all about their nutrition, and they've been on all sorts of different diets, and they've been carnivores, and now they're vegan, and now they're, who are very, very much, very in tune to what they eat, and they read their labels and all. So I don't know. I think that, we see a little bit of everything, right?
Yeah, for sure.
It's a wide spectrum. So I don't know, just if you could just impart just some simple things that maybe you've learned, maybe just a couple things that you have learned in your research, in your training and research that would be helpful, to anyone. Not just somebody who does, somebody who is doing fancy diets or who is really in tune, but even someone who feels that Captain Crunch has fiber in it.
Yeah, that's a great point. The major thing that I would say to really anybody, especially if they want to get into nutrition, is to really just kind of start doing research, but not research online. I'm just going to be honest, because it's, that's the whole problem with the nutrition industry as a whole. Like, it's really fraught with myths and fad diets, and you guys know. So there's good resources out there online, but they're going to come from more official sources, right? So if you're going to do nutrition research, you want to look at something like Healthline that kind of cites all of their sources, that looks at all the studies, that has a very comprehensive and nuanced view of the nutrition space. You want to go to places like government websites, the USDA websites, the USDA Food Bank database to really get accurate macronutrients, micronutrients, fiber, all of those recommendations, and figure out where they actually come from. There are some really good educational seminars that you can do. Universities as well have really good information regarding, actual factual nutrition knowledge. Generally speaking, I would say that if someone's not a true blue expert in nutrition and they're telling you something online, like, definitely be skeptical about it, right? A lot of times people get into more of a philosophical niche than they do into a scientific niche when it comes to nutrition. And a lot of things are more anecdotal than they are actually scientific. So really, check your sources, double check, make sure that you're getting accurate information. And really, if you want to, be a true nutrition quester, get a textbook, because that's going to be all the accurate information. They can't put fake stuff in there.
Right.
And that'll kind of show you, on a molecular level, on a cellular level, on an organ by organ basis, how nutrition actually works in the body and how we can, really work to optimize it for ourselves, because it is very much a person by person basis. And that's the tricky part about nutrition in general, is that, while we do have a good degree of nutrition knowledge out there, and there are certain universal truths about human nutrition, it's also very much something that needs to be personalized, because we all have different genetics and environmental factors, and even just, taste preferences, right, that are going to affect what's going to be the right diet and nutrition plan for you versus somebody else.
Right. Yeah.
What about the idea of, because I get a lot of patients who just say they just eat once a day, they don't feel like they need food, and I try to explain to them the importance of food in the body, right? Can you speak into that a little bit?
Yeah, I mean, I might give you an answer you don't want, but I'm a big proponent myself of a one meal a day kind of schedule, right? Mm-hmm. Doing that intermittent fasting style or lifestyle, right? Because when you look at the literature, you can see that fasting is one of the only ways that we know of to reliably extend lifespan in model organisms. And when you look at the clinical data and the experimental data, it also helps to treat, prevent, or delay most major diseases. But all that being said, that's more to do with meal timing than quality of food, right? Mm-hmm. So the quality of your food, the amounts of food that you're eating, the macronutrients, the micronutrients, the bioactives, the polyphenols, all of that you're taking in are going to have a huge impact on a day-to-day basis, not only of what you're going to feel, but how your body is going to react to things, the amount of inflammation that you're producing, the amount of beneficial gut bioactives are going to be produced by your microbiome, how your microbiome itself is going to interact. When you think about what people take into their bodies on a daily basis, we expect in a Western society kind of pills to do all of this work for us, right? Mm-hmm. When in reality, like a pill, regardless of the drug, is probably going to be no more than 1 gram worth of material, right? That's coming into your body and, supposedly doing a job. But on a day-to-day basis, we take in, pounds of food. So it's really going to have this outsized impact on our health and our vitality, especially in the long term and the short term. So quality of food is absolutely crucial, especially to make sure that you're getting everything that your body actually needs, because caloric restriction, intermittent fasting, those things can enhance lifespan, but that's only up to the point of malnutrition, right? Like if you go too low on the calories, if you're not taking in the right micronutrients, then your body's going to suffer for that.
Right. Interesting. Hey, Dr. Rhodes, do you have time to stay on with us to do?
Just keep going.
Yeah, can we just keep going? Okay, perfect. Okay, good. I just wanted to make sure you were okay on time, because I actually wanted to talk a little bit more about what you just talked about with intermittent fasting and caloric restriction. Okay, so just to make sure I'm understanding, caloric restriction, however, making sure that whatever calories you do take in are good quality calories. Can you just, for our audience and for me, define micro versus macro? You've mentioned that a couple times on the the nutrients. Can you just define that for our audience?
Absolutely. So a macronutrient is something that your body can break down into a unit of energy. So that's going to be a protein, a carbohydrate, or a fat. Those are the 3 macronutrients. And your body can utilize all of those, metabolize them, and turn them into cellular energy, which then becomes whole person energy. And that's a macronutrient. A micronutrient is something like a vitamin or a mineral that our body needs and can't produce by itself, but is required to run all of these biological molecular processes that keep us alive. So that's the distinction there.
Okay. All right. Perfect. So, and then you talked about as far as like the once a day. So is that what you do then? You stick to like 1 main meal a day?
Yep, that's absolutely what I do. And I found that, that's what works for me and my lifestyle. Mm-hmm. I really like being able to wake up in the morning, just like have a cup of green tea, take my Mimeo, and just be able to focus all day long on the task of being a CEO of a biotechnology company.
Right.
So that really helps me kind of hone in. I'm not thinking about what my next meal is going to be. I'm not thinking about, any kind of like hunger responses that I'm having. It's just like a very consistent stream of energy throughout the day. And then when the day is over, I kind of get to switch modes. I get to go from, okay, all business work mode into cool, relaxed. I get to have my big food reward at the end of the day. So it kind of helps me, keep my like business hyper focus and my relaxation time, separate in their little compartments.
So what time is your reward meal?
My reward meal is usually 6 to 7 at night.
Okay.
And
For a full hour.
I'll usually have, I'll give myself some grace there. It's not going to be like, okay, I can only eat that one meal and that's going to be it. That's usually, a window between, 6 to 8, probably.
6 to 8. Okay. So then you have your green tea, you take your Mimeo, and then throughout the day, are you just, are you just drinking water and absolutely eating nothing else?
Yeah, so I'll absolutely eat nothing else that's caloric in terms of liquids, water. But I do love like flavored sparkling water.
Mm-hmm.
I love any liquid that's non-caloric, like a Powerade Zero or like a Mio or something like that, right? So I'm not opposed to flavor, but just I'm trying to minimize the calories.
Okay, all right. And then would you mind talking about your meal that you eat at night?
Yeah, absolutely. So my meal is going to typically consist of a lot of vegetables and lean proteins with flavorful sauces and spices. So this is a principle that I kind of learned when I was in college. I took a history of food course. And it's really interesting to see how all major societies kind of developed their meal structure. So essentially what you'll have is there's 3 different components to any typical meal across societies, and that's going to be number 1, your staple grain, whatever that is, that was easy to grow, had a lot of energy, but not a lot of the micronutrients. So this would be rice or potatoes, something like that. Mm-hmm. On top of that, you're then going to have your protein and your vegetables, right? Mm-hmm. And that's going to supply you with your macronutrients, your micronutrients, all of your essential things like fiber and all of that. And then on top of that, you're going to have sauces and spices, and that's going to provide you with the interesting bioactive molecules, like from cinnamon and cumin and like ginger and turmeric and all of those interesting polyphenols. Mm-hmm. That then kind of completes your meal. So looking at all of that, you have essentially that lower layer that's very energy dense, but not providing a lot of nutritional content outside of just the calories. Mm-hmm. So I kind of just, all right, let's remove that from the equation and really focus on those top 2 layers of proteins, vegetables, spices, and flavorings that are giving you what you really want out of a meal while minimizing the amount of, excess calories that you're taking in.
Right. And so do you use like cinnamon, turmeric, ginger, are you using like powdered forms, or are you actually using like fresh ginger?
Yeah, I'll usually try to use fresh whenever I can. I've got a great Asian market that's really close to me, so really good quality ginger and like galangal and turmeric and lemongrass, and anything fresh that I can get my hands on, I usually will. But spices I'm usually using in their dried form. I'll try to buy them whole when I can and then grind them up myself, because I found that you get better flavor that way. But I'm not opposed to powdered spices either, as long as you're keeping them fresh and they're not going stale. Because sometimes convenience is king, right? Right.
And so you have then, you just eat that main meal. So basically you're fasting like pretty much almost all the entire 23.
So can you talk into that a little bit, Dr. Rhodes, about, because I know in our last podcast you talked about how fasting, you really don't benefit from fasting until you've been fasting for, is it 36 hours or something like that? So how do you
usually around, that 20 to 24 hour mark when your body depletes its stored carbohydrates, its glycogen stores, and then really switches over into fasting metabolism, ketogenic metabolism.
So, but you still see benefits of intermittent fasting then, as opposed to waiting that long to get the benefits of the fasting?
So it really depends on what benefits you're looking for. And this is, one of the major myths about intermittent fasting. There's kind of a nebulous definition about what it means, not only in the scientific literature, but in kind of common perception. So when we say intermittent fasting, in people's imagination, that can mean anywhere between, 16 hours of fasting all the way up to, 72 hours of fasting, when biologically, those are very different time points, right?
Mm-hmm. Yeah.
So for shorter term fasts like 16-8, 16 hours of fasting isn't really enough to really get your body fully into that, the fasting metabolism that we kind of associate with more of these big fasting benefits like autophagy or immune cell regeneration, or just even like cell regeneration as well. So that's more or less going to kind of give you a metabolic balance, right? You're going to have better glucose control. You're going to have more stable lipid levels, triglyceride and cholesterol. That's more or less what we've seen in the data from shorter term fasts, like 16-8 style. But you won't get those kind of pro-longevity cellular health effects until you really get into the later stages of fasting.
And what about, okay, so I've listened to, podcasts on people who had cancer, who went on these water fasts literally for days. I mean, for somebody, so for someone that has an illness, like, I don't know, anything, malignancy, cancer, whatever. I mean, are there any recommendations in regards to that?
So the literature on it is a little bit split right now, and mainly because there hasn't been a ton of it done yet, especially on the longer term fasting. There are a small collection of fasting clinics around the country. One of them is out here in the Bay Area in Santa Rosa, and they'll routinely take people who have kind of exhausted all of their other options, right? If they have lupus, or if they have cancer, if they have type 2 diabetes, and just nothing else has really worked for them, they can go and fast in a medically supervised environment. And sometimes they'll do fasts, 1 week up to 2 weeks, and it's really fascinating what you can see from those longer term fasts, because people who come in with lupus, chronic autoimmune disorder, right, they can get 6 months worth of symptom ablation after just those 2 weeks of fasting. So they have people who come back year after year just to go to that clinic, fast for the 2 weeks in a safe environment, and then they'll go back to their normal lives as if they don't actually, have their disease, until they have to come back and kind of, do the fasting again. Cancer is a really interesting one, because we've seen studies of people fasting for 3 days ahead of chemotherapy. And essentially what that does is it helps to increase the stress resistance of, the normal healthy human cells, while sensitizing the cancer cells to the chemotherapy. So it helps keep, people and their natural healthy cells safer from the toxic effects of the chemotherapy, while also making the cancer more susceptible to the chemotherapy itself. So you get, less side effects, less nausea when you actually do it, versus not fasting at the time.
Fascinating. Yeah. No, that is so fascinating to me, that whole thing, that whole theory. The podcast, I remember, this is a young woman who had been diagnosed with a lymphoma, and she had like bulky masses, like lumps throughout her body that she could feel. And I can't remember how many days she had been water fasting. Like, she actually went somewhere where she stayed there for a while, but she described how she could feel them shrinking in size. And
absolutely. And this is a really interesting phenomenon that happens with cancer cells. So many times there are certain hallmarks of what happens to a cell that make it become cancerous. And, one of those is, what's called cell immortalization. So basically means, the cell doesn't doesn't have to follow the typical rules of cellular survival that the rest of our cells have to. So their telomerase genes get really overexpressed, so they're constantly putting on more and more telomeres so they can kind of divide rapidly and without any consequence to their DNA structure over time, which is really fascinating. Another one is a shift from being metabolically flexible, being able to rely on, carbohydrates and protein and fat for fuel, like most of the cells in our body can, to only being able to survive on glucose and carbohydrates, right? So when you have a cancer that has that dependency, fasting can be really, really beneficial because you're essentially minimizing the amount of circulating glucose in your body. And the rest of your cells are going to move over to being able to survive off of the ketone bodies that your body is going to produce in response to not having a carbohydrate intake and just mobilizing your body's stored fat. So they'll be able to survive just fine, but your cancer cells are really, really going to struggle because they can't live off of those ketones that your body is producing. So they'll literally get starved out.
Interesting.
Yeah,
Wow.
that's cool.
That is so cool. Wow, thank you so much for explaining that. That whole thing is truly fascinating to me. Well, look, we can't finish this without you talking about Mimeo. You got to talk to us because we have new listeners on this, and even those that were on before when you were last with us. I'm sure they're going to want to hear this again. So please talk to us about Mimeo.
Yeah, absolutely. So Mimeo is the company that I founded based off of my PhD research into intermittent fasting while I was at UC Davis. And the point of the research was basically to understand what happens in the human body during these longer stages of fasting, in our case a 36-hour fast, and see if we could decode what was happening there that provides all of these beneficial effects of fasting, whether that's autophagy or the enhancement of longevity, these antioxidant, anti-inflammatory, cellular stress resistance kind of things. So we had people come in, fast for 36 hours, and then looked at the before and after. And what we saw was that during a fast, the human body produces this unique set of molecules that are really only produced during a 36-hour fast. And we found that those were the ones that were responsible for activating all of these cellular health and longevity benefits of fasting. So we screened through those molecules and found this synergistic combination of 4 of them that when we gave it back to people as a supplement could, basically recreate fasting at the molecular level, activate all those same beneficial pathways, and give you the benefits of fasting without actually having to fast. And so that's our, Mimeo is our biomimetic fasting replicator supplement, essentially. And we've seen, really, really positive results in it, both being able to recreate the benefits of fasting even during a meal. We can extend lifespan in model organisms by 96% just by giving them the Mimeo formulation. And we've shown that we can reduce biological age in humans by 2.5 years in just 8 weeks.
Wow.
That's awesome.
That is so great. That's so awesome. I know you told us this before on the previous episode, but it's so great. Congratulations. That's such a great accomplishment.
Yeah, it's been quite a wild ride because it's not something that you usually get to experience as a scientist, right? I thought that I was going to be in the back of a lab, just running my experiments, thinking about, uncovering the mysteries of human biology and fasting for my entire career. And then all of a sudden to see that research then, become a product that's out there in the world and actually impacting people's lives, it's very rarefied. So I feel very, humble and blessed to be able to experience it.
Yeah, that is wonderful. Very, very happy for you. So how can people find you then? You have a website if someone wants to find your product or learn more about you?
Yeah, absolutely. If they want to learn more about the product, they can go to mimiohealth.com, MIMIO health.com. And if you want to see more of me, you can also follow me on TikTok. I'm at that nutrition dr, at that nutrition doctor.
Okay. Awesome.
Thank you.
Awesome. Yeah. Thank you so much, Dr. Rhodes. We really, really appreciate you taking the time, and this just so much great information. So thank you very much from the bottom of our hearts.
Yeah, thank you guys for having me on again. It was a great time.
All right.
Awesome. Well, we look forward to talking to you soon.
Yes. All right. Wow. I'm sorry. I'm just like so amazing. So look, if you want to connect with us, you can find us on our website, drlizcruz.com. And you can connect with us. You can schedule a free 30-minute wellness consult by clicking the magenta colored button that's on the home page. If you haven't rated us, please rate us and please give us a 5. It'll help other people just like you to find us faster. And lastly, if you haven't subscribed, what are you waiting for? Subscribe so that you never miss an episode. These are great episodes, and thank you so much for joining us. We'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.